our body is such a huge component, because that's going to help us be better with our family, enjoy our friends more. It's going to help. We need it professionally to perform at the highest level, to think at the highest level, to enjoy life.
Hey, this is Dr. Wilkins at Optimized Performance Medicine.
Welcome to the second official podcast for Performance Medicine. So super excited. The first one, we were able to give a nice background to explain what performance medicine is. It's a fairly new thing. It's something that's growing really quickly, and it's something that we love and just don't feel like enough people know about it and know that it's available. So today, got Brandon Hertz here. Can't say enough about Brandon. He is just a huge asset and does so much for the patients here and the development of this practice. And anybody that's worked with him is just they get such great results. And he embraces the performance medicine. He lives the lifestyle. He's passionate about it, and so it's so fun to have him here as a staff member and to help explain some of the things that we do. But he's a trainer, and by that position, he's able to work with the providers and carry out treatment plans for musculoskeletal conditions, and otherwise he has certification as a trainer. And Brent, I'll have you tell a little bit more about that, but overall just passionate, knowledgeable, wisdom beyond his years, does such a great example. So Brandon, can you maybe give just a little bit of background about what you've done, what you do?
Yeah, of course. So about 2 years ago, I started here at Optimize, and I have a background in personal training. I have my certs in personal training. I'm also a certified nutritionist. So I see people for that. And then kind of mainly what I do here with the practice is corrective exercise, which kind of combines some of the things you might see in traditional physical medicine, but a little bit different. We try and address the cause of the problem rather than just nullifying the symptoms and things of that nature. So, I definitely try and keep with the provider's plan and get the patients, within a period of time to either, whether they're an older patient who's just trying to be more active and healthier, or they're a young athlete who's, trying to be at the top of the food chain and whatever sport they're in. But I've been doing it for 2+ years, so hands-on experience. And I just, as I was younger, I always knew I was passionate about helping people and kind of fell into the physical medicine aspect of it. But I think I was always kind of meant this is my calling. It was just something that, is more advanced than traditional medicine. Most people, they go and see a doctor when it comes to them just being completely sick, but people come and see us before they get to that point, before they have to do surgery. And that's really what Optimize is all about, is preventing surgery, trying to use less invasive techniques and modalities to help people heal naturally rather than using all this external help. So that's definitely really why I love what we do here at Optimize, and it's what we're all about.
Oh man, so many good things that you said there. And one of the things that really stuck out to me is explaining that the patient population that you work with. So you have worked with world champion athletes, professional athletes, and you've also worked with, what's the oldest patient that you've worked with?
Just today I saw a patient that was 82 years old, and she's probably in, better condition than some of my younger patients. So yeah, it kind of varies, but all types of people awesome. We see for sure.
And the thing I like about performance medicine is the medicine still applies to them. So, we attract patients that are invested in being proactive with their health. So the example with the world-class athlete, They're doing everything that they can possibly do to recover from injuries, to prevent injuries, to become stronger, metabolically understand themselves. And then you have, we've even had 90-year-olds. I think we treated maybe even 100-year-old. We've treated 100-year-old, and their performance is it's very individualized. One of the patients that we've done procedures on, she said, I want to be able to do my chores in my house without pain, and that's a valid goal, and living your life to your full capacity. And that's very individualized. And that's the approach that we take. It's not just performance, but it's very personalized medical care, and it's looking at a lot of different things. So once again, with your background, sorry that I didn't mention your nutrition background, which is huge, and you have so much knowledge and can offer so much insight with that. But that's a good example of a couple of things that are often integrated with performance medicine. And so you're taking the musculoskeletal component of that, and then you're looking at like some of the nutrition and metabolic things from that end. Can you think of like a case or two or maybe a case of someone that you had that kind of fit into that mold where you're maybe working on one thing and utilizing some other aspects of health?
Yeah, no, of course. Just today, like I had a patient who initially had seen me because they had undergone a procedure, and we were doing some corrective exercises and just general physical rehabilitation to get that knee up to par, back to functioning at full capacity. And he traveled, went back to where he was from, and then came back, and his knee pain is gone, but he had another area of life he wanted to tackle. So now it's more on the physical development, so getting stronger muscles. So he's trying to, perform hypertrophy work, so that way he feels better about himself. And then also that kind of ties into the weight loss. He came back, he's lost 26 pounds since I've last seen him. I told him to stop eating that bowl of Cheerios every morning and instead eat real food, eggs, things of that nature. And he said that made a huge difference. So it's like, I may see a particular patient for like one thing, but it's really in that time when you're learning the patient that I'm able to kind of address several different areas of their life that they may have not, paid too much attention to. Like he didn't know his bowl of Cheerios was limiting him in that way, but now he's lost 26 pounds because he switched it out. So I think there's a lot of things that kind of tie together. It's like when you look at someone, you can kind of be like, hey, just because their weight's a certain way, it's like, why is it that way? It's like, what is the cause of all this? So once you address, okay, got him moving more by helping his knee problems. So now he's more active. He's swimming every day for 2+ hours, and like all that, just kind of compiles, and you become a better individual. And that's really what we're all about, is getting people not just to where they were at before, but beyond that. So I think that's a perfect case to kind of reference.
Yeah, that is, and combining that the weight component of it, which is huge. And when you think about how much force, the knee is going to be have the force of that single leg with all that additional weight. And when you look at the physics of it, it exponentially creates that force on that small joint when it comes down to the knee and other areas as well. And that's an excellent integration of that. And that's another cool thing about our practice is he initially came to us for knee pain, and we did stem cell injection, and we were able to watch this awesome transformation. And so that got him to like, cool, now I can get back in the pool. I can do the things that I really enjoy doing. Now his personal goal has exceeded that. Now he's like, I want more. I want to have the weight loss. I want to have more muscle mass. And that becomes super important as you start aging. And it's intuitive and scientifically we understand that everything declines when you hit what we would call middle age eventually. And the muscle mass goes down, the body fat goes up, the cardiac output goes down, the metabolism, the cellular health goes down. And so that it happens a lot. I think that's a great case that you just saw today of somebody that continues down the journey, and we're allowed to have the privilege of being there with them to kind of help mentor them through their journey. And he's a great patient, and that's a great example of sharing that. Thanks, Brandon. So with we talked about the things that we've been doing for quite some time. Nutrition, the musculoskeletal component of things, and there's a whole lot more of that. So right now you're in a room with some equipment behind you, and we just started doing VO2 Max, and that's been super fun. And just like our patients, we continue to progress and to grow and to add to our practice and in our mission of performance medicine, essentially. And so you've really have made yourself an expert in VO2. And can you maybe talk a little bit about that and what you've been doing?
Yeah. So VO2, as we recently started doing it here at Optimize. It's a fairly new thing that's kind of floating around. People are like, what is VO2? And basically VO2 is just the maximum cardiac output that your body has. So how well your body is at utilizing oxygen and getting rid of carbon dioxide. And the reason that's so important is because as we age, that number is going down. And the only way to prevent that is to continue improving our cardiovascular and cardiorespiratory health in all ways. So that means moving more. And a great way to do that is with the new machinery we've got here. So what that allows us to do is, we attach you to this mask. You put this mask on your face, and then we'll have you run until you can't anymore. And that's basically how we'd achieve that maximum output. Is we're trying to see, hey, where do your lungs give up? And sometimes it's the opposite. Sometimes we see people's legs giving up before their lungs do. So, and then, how well is oxygen moving in and out of the body? And are you getting rid of carbon dioxide? How's your blood lactate look? So we're able to kind of see all these metrics and really dial down. Are you in a fat burning stage? Are you burning kind of the garbage zone where most people are at? Are you kind of just moving around, not really working out intensely, but not doing nothing either? So I think it's a great way to kind of be specific about your training and perhaps even enhance your cardio training, whether you're a runner or anything, or even just an average person who's trying to live longer, because we all know that VO2 has been studied briefly, and even just in the small studies that have been done, we're seeing that people's life expectancy is increasing by 20 years, if not more. And that's just with the small studies that have been done. So if you think about that in more of a larger context, the more you do, the better outcome you're probably going to end up with. So, that number could be higher than 20. That's just what the study showed. But I think it's great to always expand, and everyone's been doing the same thing for so many years that this is a great tool to not only enhance your cardio, but have to do less sessions per week. You do one maximum output session, maybe it's 15 minutes hard maximum effort. Do that once a week. I mean, that sounds a lot better than doing 45 minutes of zone 2 work 4 to 5 times throughout the week, and you're exhausted. It's like, why not really test your how well your body is at utilizing oxygen and getting rid of carbon dioxide with a tool such as the Max. But I think it's a really cool new innovative thing, as you know. with Optimize, we're all about being innovative, being on top of all the new technology and utilizing it to our best ability.
Yeah, no, thank you so much. And, this is a new expansion. You're in a new room that just recently finished construction, and it's up and running. And the way that I look at it from a clinical standpoint is if I go through somebody's blood work, first of all, we'll do an expanded blood work. Once again, part of performance medicine, not just looking at the basics, but really getting a good comprehensive view of things. But even with that, we get an idea of, to me, more so that there's not any red flags. Like, okay, kidneys are working good, check. Liver's good, check. No like serious inflammation or anemia, those type of things. So it tells you that you're not sick. Well, that's great. We want to catch things when we're, just really sick. And when you have a tool like VO2 Max, like me as a clinician, and use a trainer, and we can look at somebody and say, this is how healthy you are, or not how healthy you are, and we can quantify that, like just good old fashioned numbers. The true language, just measurements and numbers. It's the scientific approach at its finest. And then, once again, we work together, trainer, physician, and I can look and I can say, well, I want to do some medical interventions. Let's see what happens when we get you better in a metabolic state. And that could be hormone optimization, that could be peptides. And then in your realm, and what's important to me is we can make a diagnosis and a prescription for exercise as well. And to be able to, for you as a trainer, having that information, how does that help you to prescribe a, exercise regimen for somebody with a VO2 report?
Well, yeah, with the VO2, what that information really helps because it allows me to tailor the regimen or the program to the patient's needs. Just with everyone's different. Like some people, their cardio is going to be more of something we need to work on. Other people, it's like, hey, it's a stability issue, not necessarily like a mobility issue. So there's like all different ways, but just having that information myself, and even just, for the patient, it's critical because your body it's the most important thing in life. Like if you don't have your body, you don't have anything. So I think to kind of know how your body's operating, how effective it is at performing the natural things it's supposed to do it's critical information for me, because then I know, hey, this patient has this disease. I have to make sure I stay away from this. Or like, this patient is on this medication, so I should probably stay away from this. So like there's all these little nuances that I'm able to kind of get and utilize as a trainer and corrective exercise specialist to make sure the patient's getting the best treatment possible, but also not putting them at risk. And that's really the goal.
Yeah, so much that you can get from it. And the other thing that I like about it too is prescribing. You can prescribe, and then you can reassess and see how effective, in your case, maybe an exercise training regimen. In my case, other metabolic issues, or how well a treatment has helped in somebody. And so being able to trend those measurements very specifically, and all the information that we get is huge. And so, yeah, the VO2 Max is such a great tool that we have, and it's fun. And there's even more components to it. Like you can get so in depth with, getting a better understanding of, how well your body's adapted with mitochondrial density and capillary density, and how efficiently you're utilizing different carbohydrates or fat or those type of things. And so there's just so many different implications, and it's a great tool for me, for a lot of our patients that are like, hey, I'm doing what I can, what else is there to do? And having the VO2 to be able to say, well, let's see exactly where you are. Let's get as many measurements as we can. And, once again, this is just kind of bringing it back to performance medicine. It fits so nicely because this is using the newest innovation that conventional medicine just has a hard time keeping up with. And being able to use these, like in this case, VO2 to achieve the maximum health benefits that are possible. And so it's fun. From our standpoint, is being in the practice is just a lot of fun. Learning, always applying, being able to stay on top of the best treatments for health. So, well, Brandon, trying to think if there's anything else that we forgot but I think we got a pretty good overview of understanding a little bit more about performance medicine, what we do here at Optimize Performance Medicine, the capacity that you play in the role here is the trainer. And I don't know, am I forgetting anything?
No, I don't believe so. I think we kind of covered all the new things we've started to slowly implement into the practice. We're just we don't like to vary ourselves too much. We like to kind of hone in on what we're great at, become the best that we possibly can at it. Obviously we do tons of stem cell, or we're using PRP, recruiting people's stem cells from their own body. So we covered all that. We covered the addition of doing corrective exercises with procedures and how that plays a crucial role in people's recovery, and then how that kind of leads them down the path of bettering their health in other ways they weren't initially coming for. And I think that's what it's all about. We don't want to just be like, hey, you're good enough, let's send you away. We want to be like, hey, you're the best possible version of yourself. Let's give you the tools to succeed, or let's give you the tools to keep advancing. It's we're always trying to make you better. We're not going to just I think for everybody, there's something that Optimize can offer them, whether it be the physical medicine or the internal medicine. Either way, people are going to benefit. And I think that's what our whole goal is here.
Yeah, absolutely. That's the mission. And, lifestyle's at the center of it. Movement's a huge part. Nutrition's a huge part. Utilizing, the conventional medicine, evidence-based medicine, labs, pharmaceuticals, but expanding that to newer peptides, nutrition, IV treatments, anything to use those tools to live our best lives. Adding to your point, our body is such a huge component, because that's going to help us be better with our family, enjoy our friends more. It's going to help. We need it professionally to perform at the highest level, to think at the highest level, to enjoy life at the highest level. And so performance medicine is fun to be able to focus on that. In emergency medicine, I focus on people, at the low parts of their life, and that's a part of life too, and that's a part of medicine too. And I keep doing it, but it's especially rewarding being able to keep people out of the emergency department when they don't need to. By, once again, when you're VO2 max, if you're at your, at a great capacity, if your VO2 max is, the higher it is, the higher the predictability of the longevity of your life. And I would add my own personal opinion. That's proven. My personal opinion is the quality of your life too. You're gonna enjoy life more. So yeah, Brandon, awesome, man. I can't say enough about you. You add so much to this practice, and your knowledge is just amazing. Thank you for sharing some of your stories, some of your experience, telling us a little bit more about VO2, and we'll have to do it again sometime.
Yeah, of course. Yeah, I look forward to the next.